The preparation of a mass vaccination campaign involves mobilizing the necessary means to ensure effective vaccination. A coordination team is set up involving local authorities and all participating organizations. Its objective is to define the most appropriate operational approach given the situation in the field. The resources required for the campaign must then be assessed and practical planning performed.
Un site avec 3 équipes, ok? On concentre les 3 équipes dans un seul endroit.
The preparation time for an emergency mass vaccination campaign should not exceed 1 to 2 weeks.
On
va d'abord faire les zones urbaines et en deuxième phase les zones rurales.
The target population, that is, the age groups to be vaccinated, needs to be defined. The target population depends on the type of vaccine and the analysis of epidemiological data collected in the field. The field data identifies the most affected areas and age groups. Previous mass and routine vaccination activities should also be taken into account. Once the target population has been identified, the number of people to be vaccinated may be estimated using demographic data. The objective of a mass vaccination campaign is to optimize vaccine coverage by vaccinating as close to 100% of the target population as possible. Priority geographical zones for vaccination must be identified. To do so, the geographical areas most affected and/or most at risk of epidemic must be identified. The population size and density is also analysed. When the population is dense and in urban areas, the risk of transmission is higher. Starting vaccination in urban areas and refugee or displaced persons camps, which are the areas most at risk, gives better vaccine coverage quickly and avoids large numbers of cases. It's important to remember that a single case of measles is considered an epidemic in a closed environment, such as a refugee or displaced persons camp. Priorities for vaccination in meningitis epidemics are determined once epidemic thresholds are reached or by an unusual number of confirmed cases. And for yellow fever, both the number of cases and the persistency of the mosquito are taken into consideration. Other factors must be taken into account, such as insecurity, accessibility, and local beliefs. A map of the region must be obtained or drawn up showing the names of villages, of town neighbourhoods, and of hospitals and other health structures. For each place, distances, travel times, and road conditions must be noted. All these elements enable us to define the best possible strategy.
C'est bien d'avoir une continuité des sites de vaccination.
Different approaches may be used in a mass vaccination campaign. In urban or densely populated areas, the required number of teams is set up to vaccinate everyone in the area as quickly as possible. Teams work in parallel at the same time at different sites. In rural areas, vaccination teams are mobile. They vaccinate villages that have been grouped together at a central site before moving on to the next group of villages in the targeted area. There is no completely typical situation. The only rule is to be able to vaccinate the maximum number of people in the minimum of time. Each context must be studied carefully in order to find the best approach.
Ça nous fait 7 sites sur cette région qui est beaucoup plus vaste.
The approach chosen is the one that will give the highest vaccine coverage in a very short delay. Any previous vaccination campaigns must also be taken into account. The strategy is discussed with local authorities and concluded in the field so as to decide the best suited emergency strategy in terms of means, constraints and rapidity. It's important to plan a few extra days of vaccination in health centres for latecomers who missed the mass vaccination campaigns. Activity planning involves defining the human and logistic means required on site for the duration of the vaccination campaign. Once the vaccination strategy has been established and the timetable drafted, taking into account the priorities, one must define the number of teams required, define the number of sites for each area, estimate the material required based on the number of teams and sites, plan establishing the cold chain, order the vaccines and material.
Et au niveau logistique, 6 sites, c'est possible. Parce que là, les sites, on les installe dimanche et on ne les bouge pas pendant 3 jours.
The effectiveness of a mass vaccination campaign depends largely on the precision of its planning. The vaccination coordination team establishes a detailed timetable. The elaboration of a timetable is essential. It explains when each task should be performed. It helps define the role and priorities of each member of the teams at any given moment in time. The timetable should be revised following the evolution of the epidemic and the course of the vaccination campaign.
De vaccination, c'est en fonction de la population sur place.
It's extremely important to keep some flexibility so as to be able to react efficiently to unplanned events that crop up. Vaccination only starts once all the vaccines and injection material has arrived. To be performed correctly, a mass vaccination campaign requires human and material means and major logistical support. We need personnel to make up the vaccination teams, an adequate number of vaccines and a cold chain to guarantee their quality. Injection materials to ensure the safety of injections performed. Basic equipment for the sites, chairs, tables. Administrative equipment. Logistics capacity. All of these elements depend upon the vaccination strategy chosen, on the number of people to be vaccinated, the number of vaccination sites, the number of teams per site, and the duration of the campaign. Once an inventory has been done of the resources already available on site, we can estimate precisely what we need to do the campaign and then order it.